Okay, so to wrap up the head to toe assessment, we are going to finish up with the lower extremities. My advice to you is to think about this just like you did the upper extremities. Remain consistent. There, is one other element that we're going to check for that I'll review, and then we'll finish up the physical exam portion, and we will record a patient teaching. So after finishing, again, this is me returning to do an initial assessment. So I am going to perform hand hygiene. You wouldn't need to do this if you're just continuing your assessment. Make sure, as always, to provide comfort and safety for your patient. So I am going to finish up my abdominal assessment by covering the patient and providing them with that privacy. And then for the lower extremities, you can continue to keep your patient covered up and just remove the covers from below. Now, since my guy is tucked in quite nicely here, I am going to take the blankets all the way down, but you would want to provide the maximal amount of privacy in your video. So I'm going to remove this so you guys can see. Okay, so again, I'm thinking of it just like my upper extremities. I'm inspecting. Let's get these cute little capri pants out of here. I'm inspecting my skin. I see no abnormalities. I need to check that temperature. Bilaterally, my skin is warm and dry. Now I'm going to check my pulses. Now, systematically, as a practitioner, I always check my PTs and my DPs. You guys just need to do the pedal pulse. But again, comparing them bilaterally for strength and equality. Check those pedal pulses right at the top of the feet. So I would say my pulses are +2. They're strong and equal bilaterally. I'm going to then take to do my cap refill, noting that brisk return of blood flow, which is normal. Perfect. The only thing that we don't really assess for, or we didn't specifically assess for in our head to toe in the upper extremities, is edema. Now, if your patient had edema in the arms, I would absolutely expect you to verbalize that finding, and that is possible, but it is more likely that patients will have edema in their lower extremities. So I'm looking at Dale's legs, especially around those ankles. I see no edema, so I'm going to want to verbalize that finding. Now we're going to assess strength. So I'm going to ask Dale to push on my hands like the gas pedals of a car. Perfect. And then I'm going to place my hands on top and have him push towards him. Perfect. So my strength in my lower extremities is equal, and I see no range of motion deficits. Now, say you forgot, sometimes we forget to do the strength. If you had your patient, in the beginning of your assessment, walk into the bed, you could say, there were no deficits as far as range of motion and your patient was able to ambulate independently. Just a little hint if you do forget that portion of the assessment. So we did our C, our M, we need to do our S, and we did our T. So our sensation, again, I'm going to have my patient close their eyes. I'm assessing this as distally as possible, and I'm going to ask them to verbalize the location. So left foot below the pinky toe, right foot, big toe. So my sensation is intact of the lower extremities bilaterally. And that concludes the lower extremity exam.